Welcome back. A surge in the Delta variant of the coronavirus has reignited parents' anxiety, and for many, the safety and quality of schooling once again feels a little uncertain. What are the best ways to prepare children to physically and mentally return to their classrooms in just a few weeks? Joining us now to discuss this and more is Dr. Delaney Gracy, Director of Clinical Services at Montefiore School Health Program. Welcome, Doctor. Thank you so much for joining us today.
Thank you. Thanks for having me.
Of course. So, doctor, first, please tell us about the impact this pandemic has had on our children this past year and the changes that you've seen in your young pediatric patients.
Sure. Well, obviously, it's been a really tough year for our kids and the whole family. So, we've definitely been seeing a lot of stress, depression, anxiety in our patients. And we've seen decreases in vaccine rates, increases in obesity, and a lot of kids falling behind in school.
That is, really sad to hear. And the vaccine rates, I actually want to get into that. So I did read that routine childhood vaccinations dropped dramatically during the early months of the coronavirus pandemic. Doctor, why is this, and what risk does this pose for public health in schools?
Sure. Well, it's understandable as in the first parts of the pandemic, people were encouraged to stay home and only seek care when they urgently needed it. But because of this, kids fell behind on a lot of their routine care, including vaccines. But now you absolutely can get an appointment at your clinic and get your regular annual exam. And one of the most important things we do there is, make sure kids get all the vaccines that they need. So we are seeing delays in things like measles, and we're at higher risk for outbreaks of measles when kids fall behind like that. So we just want to make sure we catch everybody up and we're not adding that risk to, everything already ahead of us.
Right, right. Thank you so much for sharing.
Sure.
So I know that you focus on the holistic approach for children. So
Mhm.
it's not just the physical health, it's also the mental health of our children. Can you share some ways to support our children in both of these ways as they prepare for back to school on September 13th?
Sure. Definitely make sure kids are getting that yearly checkup with their doctor, because that's the way we work with kids and families directly and make sure that we're doing exactly what that family needs and finding out what that child or adolescent needs and that we're really setting them up for success. So anybody who's eligible should get that COVID vaccine for sure, anybody 12 and older. And make sure your kids understand and take the appropriate precautions like masking. But it's also really important to be as optimistic and as positive as we can for them, for the kids, and for ourselves. So it's important to stay in tune with how your kids are feeling and reach out for support whenever needed for them and for yourselves.
Doctor, vaccinating children has definitely been a sensitive topic for many parents. And currently, from my understanding, only the Pfizer BioNTech COVID vaccine has been authorized for adolescent and teens ages 12 to 17. What are the facts with vaccinating children? What are some things you want to share with parents at this time?
Well, as I said before, if there's one message that we, have today, it's that everybody eligible absolutely should get that vaccine. And again, right now it's the Pfizer that's available for people 12 and up, but there are studies being done for additional vaccines for the age groups and younger age groups to be added to eligibility for the vaccines. But the most important thing that we can do to protect everyone, including those kids who are too young to get vaccinated, is make sure all of us are vaccinated. And we really need to do that to protect those kids, because the more that we delay, the higher risk it is for everybody in the communities and for spread of things like Delta or for even new variants to develop.
Right. I also wanted to elaborate. Now, the concern with the surge of Delta, as you said, Doctor,
Mhm.
pairing with the start of the school year as well, there's a lot of anxiety in the air. How has Montefiore School Health Program helped support health and safety in schools in particular, especially here in the Bronx?
Sure. Well, Montefiore School Health Program now has full health centers in 32 clinics, 32 school buildings, and through that we work with about 97 schools, primarily here in the Bronx. And so even before COVID, we've always worked with our infection control experts at Montefiore and also our partners at the Department of Health, Department of Education, to make sure that we're doing best practice infection control in our health centers and at the schools. And this includes screening, isolation, and then management of any student who becomes sick or is potentially infectious while they're at school. And one of the things we're really excited to be able to offer this year is at our health centers in the schools, we do now have rapid PCR testing that we can test for COVID, flu, and RSV right on site. And with those machines, we have definitive results within about 45 minutes. So we can really help families and schools quickly respond and, to know definitively is it COVID or not, and then take the appropriate precautions with quarantine or just other supports.
Right. So let's talk a little bit more about preventative care. Can you tell us about the importance of well child checkups and what exactly this includes for all children and families?
I'm glad you brought that up because that's definitely, it's the time of year for that. And people absolutely need to get their well child checkups. And vaccines, as we mentioned, are very important and a huge part of that. But that's not the only reason that the well child check is important. Because we really talk to families to find out what they need and we assess growth and development. So we've seen a lot of increases in weight and obesity during the pandemic.
Mm.
So it gives us a chance to talk about that, make sure kids are on track with nutrition and healthy lifestyles. We check for things like anemia and for lead in the younger kids. And then we screen for things like vision and hearing, all of which are really important for learning and academics in school, as well as just quality of life. And I think especially now, one of the most important things we do are developmental screening, and we look at things like speech in the younger kids. And then we also screen younger and older kids for stress, depression, anxiety, and other challenges that they're having. So once we do that, then we can figure out the exact needs for a particular child and family and make appropriate connections or referrals or get supports for people as needed. And that even includes things like food insecurity or safety issues. So it's our chance to really get to know our families and really find out what people need so we can help make those connections.
Right. Thank you, doctor. And getting to know your families as well. Can you share a little bit more about vaccine hesitancy and what some of your patients have been feeling about, just insecurity with vaccinating their children in particular?
Right. And what we've been hearing, I think, is the same as across the country. Certainly, some people were eager to get it and got it as soon as possible. My daughter is 13, and I absolutely got her vaccinated the first week that she was in an eligibility class. But people are worried about side effects and just worried because the vaccines are new and that, they haven't been used as long as some vaccines that we're all used to, like measles or pertussis. But they've absolutely been carefully tested, and now millions and millions of people have gotten these vaccines and done quite well. So I think the important thing to know is that the risk of side effects is extremely low, and we're all at much higher risk to become ill or have hospitalizations or complications or even death from COVID if we're unvaccinated. So the vaccine is incredibly important. You still can get COVID if you've had one of the vaccines, so you may be hearing that or talking about that in the news. And whereas this is true, the people that do get sick or get the breakthrough infections don't get nearly as sick as people who aren't vaccinated. So most of the people that are currently hospitalized or really struggling are people who are unvaccinated, and that's for kids and adults.
Thank you for that, doctor. I know that's something else that, is a confusion for a lot of people is that in the beginning of the pandemic, COVID wasn't affecting children as much as it is now. Can you elaborate on, these new developments and the fact that children are being affected by coronavirus today?
Sure, and some of that may be because of Delta variant and that it's more contagious, more transmissible, and so more kids may be getting sick and getting infected because of that. But I think it's also because there's this huge age group of under 12 who none of them have been vaccinated. Just proportionately, we have a higher number of those kids who are the people in the hospitals now. We're doing pretty well in the Bronx right now, but across the country, we're really seeing those increases. So it's important for us to stay ahead of it as a community and protect the little ones by all of us that are eligible getting vaccinated.
Right. We want to take advantage of the fact that we have you here, a Bronx doctor. Can you please leave us with our parents and educators with a message on how to best approach the upcoming school year from your perspective as a doctor?
Sure. Well, get those vaccines. I know I said it 100 times, but that is absolutely the most important thing we can do to protect our kids, protect our communities, and get back to normal as much as possible. That's the one thing we can do. In-person learning is really important for kids and adolescents for their social and emotional development, as well as their academics. So it is really important that we all work together to make it safe for them to be able to go to school in person. I do think optimism and stress management are really important. And that means we need to take care of ourselves as parents so that we're able to do it for our kids as well. So creating those opportunities to talk, share fears, find what we're grateful for, really connect, those things are important. get that well child check, make sure that, we've screened you and your child for everything that you specifically might need so we can do those referrals appropriately. And even outside of that well child check, if you have any concerns about stress, depression, suicidal thoughts, any mental health issues in yourself or in your children, reach out. Don't wait on that. Reach out immediately, and we can help you get connected to the support services that you need.
Absolutely. Our doctors like Dr. Gracie are here for us and our families here in the Bronx. Before we go, Dr. Gracie, can you also talk to me about the importance of the relationship between doctors and policymakers as well? When it comes to transitioning back to school, doctors play a huge role in creating these policies and enacting on them.
Yes, well, and I appreciate that, and I'm happy to live in the Bronx and in New York right now because I think we've done a really good job with the policies here. The kids will be required to wear the masks in school, and that's absolutely important, especially since everybody can't be vaccinated yet. So I think some really good things have happened there, as well as getting the vaccines out for kids as quickly as possible. So we want policies to be based on science as much as possible. So we always appreciate the opportunity to advocate from the physician perspective for the kids and the families that we represent.
Thank you so much, Dr. Delaney Gracy, Director of Clinical Services at Montefiore School Health Program, for joining us today and sharing more about, preparing for back to school.
My pleasure.
Thank you. Well, that's all for our show today. I'm your host, Sonyi Lopez, wishing you and yours safety and wellness now and always. See you next time.